This week's mind map focuses on some key ideas by Sigmund Freud. Psychoanalysis was Freud's therapy approach, which involved exploring the unconscious mind and how past experiences and hidden thoughts influence behavior and well-being. We're going to look at some of the key components underpinning Freud's psychoanalysis. The first is the concept of consciousness, and that most of what goes on in our mind is unconscious or unknown to us. There is a preconscious section which consists of information not immediately available, but that which can be easily brought into awareness, and a small part of our mind that is conscious, which is what we are actively aware of. Freud believed that the thoughts, desires, and memories in our unconscious mind could not be brought to the surface except through symbolism in our dreams and associations revealed through his talk therapy technique, free association. This involved patients speaking about anything that came to their mind in response to a particular prompt. Next, we have the three internal structures of the mind. The id, which is our uncontrolled desire and emotion. It exists only in the unconscious mind. The ego, which is where we make rational decisions. This exists mostly in the unconscious, but also in the preconscious and the conscious as well. Finally, the superego, which is our morality and conscience center, derived from societal norms and upbringing. The superego is also predominantly unconscious. Freud believed that these three structures are often in psychic conflict, and it is the ego's role to find the middle road between the id's desires and the superego's morals. The ego's ability to do so well can be impacted by the next concept, which is stages of development. The oral stage, occurring between birth to 18 months, is when the child is primarily ruled by the id. The anal stage, occurring between 18 months and 3.5 years, sees the beginnings of the ego, and the phallic stage, between 3.5 to 7 years, relates to the superego. If something happens during this time of development, regression can occur, shown here in this backwards arrow, which is when an adult behaves in ways characteristic of an earlier age that it has retreated to. Finally, we have the libido, which refers to the mental energy, which we have a limited supply of. It is the driving force of the id. When we go down to the separate section of adulthood, we can see a few of these key concepts interact. In a healthy adult, we have a well-formed, strong ego, which is able to balance out the id and the superego with a balanced amount of libido on each side. However, in a situation of fixation, too much libido remains in an earlier stage of development, characterized here by more libido in the id, as the libido drives the id, meaning there isn't enough energy left to face adult challenges.